So now we're going to be talking about massing phases. So with the massing phase, it's often commonly known as a bulking phase, but I'm not particularly a fan of that word just because bulking kind of lets people go all out on the period need without any kind of restraint, which isn't the ideal way to do it. The goal in this phase is to gain body weight and body mass, muscle mass more particular, and you consume more calories than you burn, which means you're in a hypercaloric dieting and you will gain some fat, but the focus is to minimize that fat gain. So we want to basically grow as much as we can. We want to have a high caloric intake maintenance to make sure we have enough energy and raw materials to hypertrophy our muscle because hypertrophy is a energy intensive process. Now, the length of a massing phase can really be very different depending on the individual. The longer it is, generally the more mass they're going to gain, but they're also going to have an excessive accumulation of body fat in some cases. So this is where having a massing phase with the lowest amount of calorie surplus possible to gain is going to be ideal. Now, in some situations, and we're going to talk about this more in the mini cuts, is we can use mini cuts to strategically increase the overall length of the mass gaining phase. So, for example, you do 16 weeks of mass gaining and you find that you've gained a little bit too much fluff. Cool. What we do is we do a 2 to 4 week mini cut and then we go right back on that mass gaining train. There's nothing fancy about it. It's just a quick little diet, and what it also does is reset hunger signals as well. So one of the downsides of a massing phase is over a period of time, you can, eating in a hypercaloric state, you don't feel as hungry. So having a quick diet break where you actually lose some body fat, you won't lose muscle because it's not long enough and you're still training. And eating less food, you actually regain that hunger again. So that can be very useful for some lifters. So how to implement it? Get their TDE, add 10 to 20% more calories to create a surplus. The variance in those numbers will be based on the individual client. So if someone doesn't gain weight at all, like they're just super slow, we may need a higher caloric surplus. We may need to have a smaller caloric surplus if someone gains quite quickly. And generally, carbohydrates are our best fuel source because they'll provide the energy for workouts and also improving muscle glycogen. Now, our downsides of massing, fat gain, and slower muscle gain. So that's the biggest downside. You will gain some fat. As long as it's a moderate surplus, you'll generally be okay. And as the caloric surplus increases, you may go over what's called a tipping point where you get incorrect partitioning effect. So you gain more fat relative to muscle over a period of time. There's no data on it based on body fat percentage. Like people say, you shouldn't get above 15% for a guy, shouldn't get above 22% for a female. In a massing phase, we can't actually guarantee that. Okay, so for most people, you base it on their rate of progress and how they feel in their body. So minimize risk with moderate surplus, as talked about before, strategic mini cuts, focus on hypertrophy training as much as we can, and just limiting excessive cardio. So it's not limiting cardio totally. I still recommend most people, nearly all people, maintain cardio in their training programs, but we want to minimize excessive cardio just to stop the risk of muscle loss, plus the extra fuel that you'll need to consume in order to get the outcomes that you want. And then again, training should be all hypertrophy as much as you can. It doesn't have to be compounds like there. It's whatever the athlete or client responds best to. So generally, our recommendations are 2.5% of body weight per week to be gained. That's going to kind of maximize that you're going to be gaining the majority of the lean muscle, and up to 1 kilo a month generally seems to be pretty good. And that's going to ensure that the majority of the tissue is lean mass. You will gain some fat, but again, we want to keep it as minimal as possible. And what will happen is, because someone is in a surplus, they'll have better energy during training, they'll have better performance and faster strength gains. Because muscle mass is super slow to accrue, your best tool is to measure and record your training performance. And if your training performance is going up, then guess what? It's a pretty good sign that your gym-based, that your muscle mass is going up as well, which is happy days. So summary of massing phases, we want to gain muscle, minimal fat, 12 to 20 weeks with possible mini cuts, 10 to 20% more calories in TDEE, primarily for carbs, hypertrophy with progressive overload, a little bit of fat gain, and up to 1 kilo per month. That's the goals that we're looking at for that. So if you can do that for your massing phase, you'll be in a very good place.